Right, in an unprecedented year, Professor Salim Abdool Karim has become the face of the health response to COVID-19. But now government's top coronavirus advisor has stepped down, saying he needs to devote his attention to HIV research and other academic pursuits. He joins us to look back on a year advising government in the midst of a pandemic relating to a new virus when the science was still developing, not always very clear and solid. We're joined by Professor Karim, who is still the director of the Centre for the AIDS Programme of Research in South Africa, CAPRISA. Professor, great to have you with us. Thank you very much. Firstly, is this really all about HIV and what you're doing in other areas? Should we read anything into it that you're possibly tired, dismayed or fed up at all?
Good evening, Francis, and good evening to all of the viewers. No, I'm a person who's always been forthright. I've always said it like it is, and even when the information I had to convey was not the best news, I conveyed it in a very clear and a concise way. So when I say I'm stepping down because I have important research to get back to, that's exactly it. I think sometimes it's not always clear to people that in taking on this responsibility on the 23rd of March last year, I had always committed to doing it for a year. And so exactly a year later, I'm stepping down. Because in doing this for a whole year, you have to do it full time. The public, the country, the epidemic just demands that. There is so much effort that goes into this task. So I had to put everything else on hold. And putting it on hold for a whole year was a challenge by itself. Yeah. So it's time to get back.
As the Health Minister's top advisor for a year, do you feel like you've really been heard? And you say you're forthright. I mean, did you feel you had the freedom to be forthright and transparent, even when there were disagreements over issues, maybe?
Yeah, I think it's very important that in a committee like ours, that there are many different voices. I've often said that, in academia, the strength of academia is the contestation of ideas. It's that we bring different perspectives, different interpretations, and each of us, adds value to the eventual decision. But we should never interpret differences of opinion and differences among scientists as anything more than simply robust academic discussion, because we do it all the time. In fact, when we have a research meeting, we spend time challenging each other's research. That's how we make sure we get the best product. So it's never been an issue for me. I think what has been important is that we have provided over this past year well over 100 advisories. I have been working with the Secretariat to look at a tracker as to how the advisories have been taken up. And I was very pleased to note that most of the advisories have been implemented, either in the form of policy, or they've changed guidelines, or they've instituted memos to the provinces to act on. And that was very reassuring. As an advisor, I'm very clear. I don't make any decisions. And I don't expect that the decision makers will only listen to one advisor, or will only listen to one committee. I will assume they have a wide range of advice they receive. Yeah. And if they take most of my advice, I'm happy.
Well, this is so interesting what you're saying, that most of the advice was taken up, because government has at times been criticised for not taking health advice. Let's look at the advice that schools should remain open. And in some cases, it seems like the health advice was ignored, not for the sake of the economy, but to the detriment of the economy. I'm thinking of online retail sales being banned at some point. Was that frustrating for you?
Yeah, I think there are many lessons to be learned. I think because of the high level of uncertainty, and the government is getting advice from us from a health perspective. They have their own set of advisors on economics. They have their own set of advisors on a whole range of different things, including legal perspectives. So what we would advise is not necessarily that would only carry the day. I have found that in most of the advice that we have provided, that at least some aspect of our advice has been taken up. So if you look at, just simply the issue of schools, we provided quite clear advice at 3 different points about the steps involved in opening schools. And when I look at the eventual decisions, for example, on our first advisory about opening schools, the decision was in line with what we proposed. But they postponed it for about an extra 2 weeks or so. So we had recommended that we felt that the situation was fine for schools to open. These are the conditions it should open under. And they accepted all those conditions. They accepted that schools should be open. But they felt they couldn't implement that straight away. They needed an extra 2 weeks to get things in place. So I understand that. Implementation is very different from just sitting in a desk saying that you should do X and Y. So I felt in the school situation, our advice was mostly taken and taken well.
What about when taxis filled up? That seemed to be a political choice, maybe linked to the lack of transport infrastructure in South Africa as well. But surely as a health practitioner, that must have left you perturbed.
Yeah, so on the taxi issue, when we looked at the issue of public transport, we provided an advisory that aeroplanes, buses, taxis, and trains should operate on the basis of roughly 70% occupancy. And 70% occupancy translates roughly to 1 empty seat per row. But it turned out that in our advice that was provided, aeroplanes couldn't accept that advice. It couldn't be done. The aeroplanes don't function the way we had anticipated that they would be willing to make a seat available. So they weren't able to take our advice, and our advice was not implemented in aeroplanes. So aeroplanes fill up 100%. With regard to taxis, I was asked to specifically attend the meeting with the taxi associations, and they presented their own set of arguments. But in the arguments, the approach that was proposed was that the short-term trips that are below an hour, that they would be 100%, but those that are more than that, they would be a 70%. Now, the problem came about then. The Department of Transport asked the MAC for more advice. If we had to go above 70%, what would you require? We provided a new advisory in which we said, if you can't maintain 70% occupancy, here are the 5 things you should do. Window jammers, a jump seat empty. And every one of those was taken. So we can't anticipate that we will say A, B, C, D, and they will follow all of those all the time. That they follow most of it and find compromises along the way, that's fine. We have to work with that as long as that the bulk of what we're saying is achieving our goal of slowing the virus down.
And you did admit along the way, scientists were even debating amongst themselves. It wasn't always clear what steps to take. So now we're a year later. So let's look at Easter coming up. There's speculation that it may be cancelled or maybe just a few tweaks here and there, a new curfew, alcohol sales affected. What do you think we should do as South Africa?
Yeah, so it's very important to recognize where we are in the epidemic at this point. When we look at the current number of cases, the number of tests being done, the number of admissions and deaths, we are in a position of low transmission. The number of cases between 1,000 and 2,000, our percentage positivity is at about 4.4%. So all of our markers tell us we are in a position of low transmission. We were in the same position in about September last year. So that position is a pretty good position to be in. We'd like to have 0 cases, but that's not practical and realistic. But at about 1,000 cases per day, that's a pretty good position to be in. What we have to do is protect that. We cannot have a situation like we had in November. In November, we were in a good position just like this. But what happened? You remember a nightclub called Tin Roof? in Cape Town where young kids went and spent the night and ended up spreading the virus. We had an outbreak at Fort Hare University when students went and spent the whole weekend at a tavern. And then eventually the Belito Matric festivals that led to over 1,000 cases. So these gatherings, they present to us a very high risk. And that risk is that they could ignite another wave. So we have to avoid that.
I ask because there is a concern in some quarters, the question being asked, are we not, as citizens even, not only government, but as citizens, too easily welcoming the suspension of our liberties when there is mixed research on lockdowns? There were several hundred cases the other day. Like you said, there's around 1,000 now. But this is in a country of millions. And you would know more, maybe TB rates can be a comparison with COVID right now. But surely if we're in low transmission, the economy has been gutted, we shouldn't go into a lockdown or new measures too easily.
Yes, I think there's often this misconception that, when we're in low transmission, then we can become complacent. Then we don't need to worry too much about our masks being up. And I see that. I see that when I have my morning walk. When it was under level 3, everybody was wearing their masks and so on. Now, when I walk in the morning, most people, their masks, I'm lucky if it's even below the chin. So that's what the problem is. The problem is that this virus is not going anywhere. It is with us. We have to maintain our vigilance and continue with our prevention measures. Whether we're on level 1, whether we're on level 3, doesn't matter. If we are not in a position to implement our prevention measures, washing our hands, making sure, we are not sitting indoors in closed places, if we don't do those things, the virus is going to come back and we're going to go into another wave. We've got to be able to do that. Now, if we can't, the government has to help. All our measures are designed to maintain and try and get us as quickly as possible and maintain us in low transmission. And that has to be done by a combination of people voluntarily changing their behavior and government assisting and facilitating that. So it's always this very careful balance between the two. And how we do that, it's important that all of us as citizens, that we maintain our vigilance. We don't just, roll over and die. There must be good rationale. And this government has been repeatedly challenged in court. And in every case so far that I have given evidence, which is quite a few, the government has always won those cases. So our courts are there to protect us so that our liberties are not being challenged without good reason.
And that is a balanced view, talking about balancing act. Professor, so just let us into your mind a little bit. About a year ago, just over a year ago, you were appointed as the the chair of the Ministerial Advisory Committee. At that point, we didn't know much. How are you feeling about COVID-19? What do you think we have learned over the last year? And how long, if you had to just take a guess, how long do you think we're going to live with this pandemic?
There's a lot in there. So let me answer the last part first. It's all very clear to us that we only know a fraction of what we need to know to really deal with this virus. And we are growing, we're learning, there's research on an ongoing basis. What is clear is that vaccines work, but what is also clear is that the virus is responding by creating variants. And those variants can escape the vaccine immunity, or at least compromise some of that vaccine immunity. So this is going to be a long-term cat and mouse game between the body's immune system and our vaccines and the changing virus and how that virus is evolving to escape it. So we have to understand that this virus is going to be with us for quite a while. and by quite a while, I mean a few years. It is not something that we're going to get vaccinated and then we can stop wearing masks and so on. That's simply not going to be the case because of our concern about variants. Second is, what have I learned? Well, the first thing was when I was appointed, nobody asked me. It was just announced at a meeting. But I didn't need to be asked because it was my duty. It was my responsibility. If I was asked to do something, I was going to do it. But I understood very early on the importance of that meeting where I was appointed on the 23rd of March, because I've been involved in many epidemics. I have never seen a situation in an epidemic where the government brought together 60 or 50 scientists, we were quite a lot of people in that meeting, to come and give them advice. It's been the opposite experience for me in the past. I won't go into details. But for me, that the government wanted us, set the committee up. It wasn't scientists trying to tell the government you need our advice. It was the government saying, please come and give us advice. Come and do so of your own will. Yeah. And that for me was a powerful thing because it told me and set the tone for what was to come.
And that openness, I remember, was lauded right from the beginning. I have so many more questions, but we have to leave it there. Good luck in your future endeavors, and thank you so much for looking back on this past year with us. That was Professor Salim Abdool Karim, who now, still is the director of the Center for the AIDS Program of Research in South Africa.